Alberta Screening and Prevention was initiated after conducting studies and research and determined these maneuvers allow primary care providers to have the biggest impact. This work was completed by an ASaP working group that included primary care physicians, and these guidelines were based on the general population. So HealthQuest has created an ASaP template. As you can see here, we can identify who last updated it and when. It gives you the age of the screening maneuver, how often it should be completed, and then obviously the name of the maneuver as well as the results. So this top section here is your vitals that can be auto-populated from your most common chart notes. Then we've got the lifestyle screening that you can manually type in responses in here, potentially from a lifestyle questionnaire, and then obviously the date that it was screened. And then this date on the left-hand side here in red can tell you when it is next due. This will come in handy for using this as a patient handout. Then we go into the cardiovascular screenings. So we have the lipids. You can see here that the values of the lab result as well as the date will auto-populate underneath here, or you can type it in manually if it was done elsewhere. Then we have diabetes, the same thing here, gives you the values as well as the date that it was in the chart. And if we continue scrolling down, the cancer screening section here, so we have the colorectal cancer screening, when it's next due, and then we can populate the FIT test value and date. And then if we have a colonoscopy scan type, we can populate that date as well. Same goes for the mammogram. We can populate the scan type date for that, and then just typing in some extra information in this text field. And then the pap test, we can populate the date of that lab result as well. Both the pap and the mammogram will only appear on female charts. For male charts, this will simply just not be there. And then at the bottom here, we can see that it is suitable for general population, and we do need to allow for individual patient variations.